Subject name is Clinical Biochemistry. Topic on diabetes mellitus. Diabetes mellitus is a autosomal recessive disorder. It is due to disorders of carbohydrate metabolism. Insulin secretions is very low. Insulin action is very low. DM patients blood glucose concentration fasting 70 to 120 milligram per dl. After food intake 140 to 200 milligram per dl. Types of diabetes mellitus: type 1, type 2 or type 3 and gestational diabetes mellitus. Type 1 insulin dependent diabetes mellitus, young people, or juvenile type of diabetes mellitus. Type 2 old people above 40, onset or maturity diabetes mellitus or non-insulin dependent diabetes mellitus. Main causes are genetic factors of DM patients: age, hereditary, genetic factors, lifestyle, obesity, infections. Another one, third type or gestational type, only induced for pregnancy and imbalanced hormonal actions that causes the gestational diabetes mellitus. Another one, symptoms of diabetes mellitus: polyuria, polypepsia, polyphagia, glycosuria and PCOD. And polyuria, excess urination, excess thirst, and glucose concentration increased in urinations. Another one, complication of diabetes mellitus: diabetic nephropathy, diabetic neuropathy, foot ulceration also causes in complication of diabetes mellitus. Mainly treatment and management of diabetes mellitus: carbohydrate, fat or restriction, fiber are included, and vitamins and minerals are included. And the diagnosis for DM patients: so first one is blood sample diagnosis, another one is urine sample diagnosis. Blood glucose concentration is analyzed, urine sugar concentration is analyzed. Another one is test of GTT. GTT means glucose tolerance test. There are two types of tests. First one is oral test, another one intravenous test. Oral test means there are sample 75 gram of glucose dissolved in 100 ml of water, intake of persons. So half an hour, 1 hour, 1.5 hours, 2 hours and 2.5 hours variation are identified. Normal patients are curve or representation. Half an hour glucose concentration is increased, after low level or decreased. 2.5 hours adoda concentration is decreased. The normal patient curve is identified. Another one, DM patients are identified. First half an hour glucose concentration is decreased, last 2.5 hours is increased. There are two different variations in normal patients or another one DM patients. Comparison of graphical representation. And DM patient, there are three types: normal, moderate and severe. Three levels are glucose concentration are identified. Another one is the hyperpituitarism, hyperthyroidism, hyperinsulinism are action of DM patients. So another one is atherosclerosis. Atherosclerosis means thickening, hardening of artery walls. There are three symptoms causes for atherosclerosis patient: fat streaks, fibrous plaques and complicated lesions. So fat streaks means initial stage of heart patient. Second one, fat streaks, fat core as a normal size. Complicated lesions means fat core size is increased level. There are patients are maintained for the treatments, for example fat restriction or HDL level are improved. For LDL cholesterol is low level or HDL cholesterol is increased in patients. So LFT means a liver function test. Liver function test is important test for the liver action. Liver is the major metabolic reaction: carbohydrate metabolism, protein metabolism and fat metabolism. There are three metabolic reactions occur in the liver. First one is the carbohydrate metabolism, second one is the protein metabolism, third one is the fat metabolism. There is an important function for the DM patients. So especially diabetes mellitus or the classifications, types, diagnosis and treatments and testing important for patients. Once again, thank you.